welcome everyone. Welcome to our information session. If you're able to turn your cameras on, I'd love to see you. I am Dr. Audra Cave. I am the department chair for the Department of Family Nursing, and we're going to spend a little bit of time this evening telling you about our Family Nurse Practitioner program here at Frontier. So start off by thanking you for spending some of your valuable time with us. We do have some other Frontier representatives here tonight. I'm going to give them an opportunity to introduce themselves to you. We have George Duvall here with our clinical advising department. George, you want to say hello?
Hello, everyone. Looking forward to speaking with you and hopefully working with you when you start Frontier.
Thank you for being here, George. And we have Sandra, who's going to represent the admissions department. Sandra, are you here?
I'm actually here for standard today. My name is Martha and I'm part of the admissions team.
Martha, thank you for being here with us. It's nice to see you. And Dr. Nancy Pesta Walsh is here tonight. Let her introduce herself.
Hi, everybody. I'm Nancy, and I am the clinical director for the FNP program.
All right. So we are all here to welcome you and give you some information. Where's everybody from? Does anybody want to speak up and tell us who you are and where you're from?
I'm from Massachusetts.
Welcome. Very nice. All right. Anyone else?
I'm from Anacortes, Washington.
Welcome.
Thank you.
I'm from
Good evening.
Arizona. Oh,
Arizona.
sorry.
Very nice. Very nice. We love hearing your voices and seeing your faces. So what we're going to do tonight is tell you a little bit about our program. We're going to tell you about our services and what you can expect as an FNP student here at Frontier, and then we'll have plenty of time for questions and answers and just get to know each other a little bit.
And if you have questions that you think of while we're talking, you can throw them in the chat because we'll be monitoring that as well, okay?
Thank you. All right, so here we go. So first, to start off with sort of the purpose and the philosophy of the Department of Family Nursing, we are here to prepare our students as family nurse practitioners. As you can imagine, that is a broad scope, so you'll learn to take care of and provide primary care services to families, all age groups. We do have a focus in rural and underserved areas. We, of course, are a distance program, so we're structured with off-campus community-based type structure. And of course, this is the F&P specialty track. This picture right here that you can see, as we'll talk tonight, we'll tell you about 2 trips to campus that our students take. And this is a group of students who are standing around our big fire pit next to our pavilion on their trip to campus. So Frontier enjoys culture of caring. We believe in fostering a culture of mutual respect and professionalism, kindness and caring. And we found that when we do that, the entire community succeeds and prospers. So you'll hear a lot about that if you become a student at Frontier. The culture of caring is one of those foundational things that we carry through at really every aspect of our time at Frontier and our students as well. You will do your coursework primarily at your flexibility, right? So we have your community as your classroom, but really it's flexible. You can build your study time around your schedule. Your community as your classroom is also part of your clinical experience. So our students will do all of their book work or didactic work up front, and then you'll do your clinicals at the end. And of course, that is in your community. You will travel to our beautiful campus in Versailles, Kentucky, for an orientation trip, which is about 2.5 days. And then just before you go into clinical, we have a clinical orientation and preparation course that's about 4.5 days, where our students come back and they practice all of their skills prior to going into the clinical setting. And these students here are at a clinical bound session where they're practicing their skills. Some of our achievements, when I look at these numbers, I'm always a little impressed with the numbers we've got here. So we have 100 years of experience in nurse midwifery and family practice nursing. We are celebrating our 100th year anniversary this year. We have students and alumni in every state. We have over 2,500 currently enrolled students and over 10,000 graduates. So wouldn't be surprised if you've run into one of our graduates before. And this picture here is at our graduation ceremony. We have a graduation in September where our graduates come back and walk across the stage. And this is a picture of 3 of them as they're getting ready to do that. We're proud of our achievements. As you can see on this slide, we have a long-standing reputation as one of the great colleges to work for. We have received awards and recognitions as a leader in diversity, higher education excellence, belonging, and sustainability. And then this last year, we were named as an academic honoree for Sigma Theta Tau, which is the Honor Society in Nursing, as a healthy work environment. Some of our achievements, there are a few more. The F&P department at Frontier was the first F&P program in the country back in 1970. We just recently celebrated our 50th anniversary in 2020. So I guess that makes us about 55 now. And we just received some of our updated certification pass rate scores. Our pass rate in 2024, when you go for your certification exam as an F&P, you can take 2 certification exams. One is from the American Association of Nurse Practitioners, and our 2024 pass rate for that exam was 96%. The second one is the American Nurses Credentialing Center, and we got a 100% pass rate over the last 3 years for that exam. And just to give you a little comparison, the national average for the pass rate for the F&P certification exam is around 83%. So we're very proud of that score there. And in the picture, you can see one of our graduates. To her right is Dr. Pesta Walsh, behind her is me, and then to her left is our interim dean of nursing, that's Dr. Diane John. All right, so I'm going to turn the mic over to, let's see, George, do you do this slide or is this?
No, I think I do the next slide.
Okay, Dr. Pesta Walsh, do you want to talk about student support?
I sure can. We have a large network of staff in place to support you as students. So we have a large network of faculty, and then we have a large network of staff. So there's didactic faculty that work with you through the didactic portion, and then there's clinical faculty that work with you while you're in clinical. And they kind of start with you from the beginning to help guide you in the site selection process for preceptorships. We also have a whole team of academic advisors and the clinical advisors, and George is one of the clinical advisors that support you along the way. So the academic advisors will take care of you from start to finish, and the clinical advisors will help. Well, George will talk to you about his role later on, but they help you find the clinical sites that are located near your area that our students have used. We have many online mentoring groups and special interest groups that you can be a part of. And then there's a large financial aid and division and many, many scholarships. And I don't know the exact number of scholarships that we give out, but we have 2 scholarship cycles each year, and they give out thousands and thousands, hundreds of thousands of dollars each year. And then, of course, a very large online library and access to their services as well.
There we go. There's the scholarships.
Yeah, lots of money given. Actually, I said hundreds of thousands, 1.7 million in scholarships given in 2024. Like I said, we have 2 cycles each year. You do have to have some sustainability at our school in order to apply for them. So 24 credits, keep up with a GPA of 3.25. But there's many scholarships available to you. And we encourage you to apply for them when you meet these criteria. We encourage you to apply because a lot of students get awarded these scholarships.
Thank you.
Okay.
This might be George.
Yep,
Yeah.
this is me. Okay, so like Dr. Pestewa says, one of the great things that you do once you get here, you're going to begin to see that story begin to unfold as you look at your program. And typically, when you're going to see the clinical advising team, and I'm a member of one of those team members. And once you click on there, we're going to be able to assist you to find some of the local resources and sites that are there to help you find a preceptor. And we're going to work with you on a one-on-one basis. Sometimes we find the students coming in, they have a little bit of hesitancy on how to start and finding preceptors. Well, we're going to give you the tools to help you get there and help you build up your confidence. So when you walk into those offices, send those emails to those potential preceptors, we want to make sure that you, as a FNU student, feel very confident moving forward. And throughout this process, once your story becomes unfolded, you're going to see each of those academic advisors, clinical advisors, your RCF, and your credentialing all unfold in the story of your journey throughout your clinicals. So we make sure that you are surrounded by a wonderful support network, a team of staff that are here in Kentucky and across the United States, helping you find preceptors. So we look forward to welcome you once you start with FNU. And if you're on my caseload, come with a lot of energy because we're going to get you to the end. Right.
Thank you, George. I love it. Okay. So the degree options that we offer at Frontier, we have the MSN degree, which is the master's degree. The postgraduate certificate, that is a degree that typically this person has an MSN already in another specialty or another area of nursing, and they come back to Frontier to get what we call a postgraduate certificate in family nursing or certified nurse midwife or whatever specialty that they prefer. We also offer a DNP, a Doctor of Nursing Practice degree. So those are our degree options. The time frame, which I know you're very interested in. Frontier is built on a term system. So our terms are 11 weeks long. We have a 2-week break in between each term, and we offer the terms 4 times a year. And that's really nice because what it does is it means that our courses are offered every term. So in some programs, you might only have a course offered once a year. And if you don't catch it when it's offered, you might be delayed a little bit. Frontier offers their course every term to keep our students on track so that you can march through the program. If you're in the MSN track, you can anticipate taking about 2 to 3 years to complete your degree. If you're one of the postgraduate certificate students, it's about 1 year to 1.5 years. And our DNP program, which is after you have received your MSN or PGC, that's about 18 months. So that's your time frame. Believe me, it flies. And then I'm going to turn this over. I believe it was Mary.
It's Martha.
Martha, I'm so sorry, Martha.
No
Thank
worries.
you.
No worries. So we'll go over the admissions criteria. Applicants must be a registered nurse and they must have a current active license in the United States with no encumbrances. You must have a BSN degree. If you have a bachelor's degree in a different field, you are welcome to apply with a portfolio. You must have a cumulative grade point average of a 3.0 or higher from the most recent degree earned. good academic standing in prior education work, and have 1 year of registered nursing experience.
And then Martha, can you speak a little bit about New York?
Yes, for students that reside in the state of New York, they are able to apply for the program. If they are admitted to the program, they would have to complete their clinical hours outside of the state of New York. That could be one of the surrounding states, but they must also be licensed for the state that they decide they will practice at.
Thank you.
You're welcome.
And in this, go ahead.
Caveat to that is they do allow students to do clinical in New York if it's at a government facility,
Federal site, right?
something like that, a
VA
government
or
site.
federally qualified healthcare
Yeah.
center. And this picture here, you see students practicing their suturing skills. Now, this is a group of students at Clinical Bound learning how to suture. All right.
All right, now for the admissions criteria for the postgraduate certificate is similar. The applicant must have a current active license in the United States with no encumbrances. They must have a master's degree or higher in nursing, have a cumulative grade point average of a 3.0 or higher from the most recent degree earned. Your MSN does need to have an NP specialty. It could be one of the ones listed here, and an APRN license and certification if you have it.
Thank you.
Okay, we are currently accepting applications for the fall 2025 term. The deadline is June 25th, and the course begins October 6th. The next term is winter 2026. The applications will be available on June 26th. The deadline is September 24th, 2025, and the coursework begins January 5th, 2026. To submit an application, you will complete the online application, submit an essay, resume, transcripts, portfolio for those who don't hold a BSN, and the current estimated cost per credit hour is $685.
Thank you, Martha.
You're welcome.
All right, Dr. Pesta Walsh.
Okay, I was going to say, I'll take this one. For clinicals, MSN and PGC students are required to have at least 750 clinical hours. And we have time parameters on that. So you have to attend at least 16 weeks of clinical. So we do up to 40 hour a week. In clinical, you can do up to 40 hours a week. So that's 16 weeks for that. And the DNP is 500 clinical hours in their program. We have our clinical requirements for FNP. You have to meet the competencies for each clinical course. We have 3 clinical courses. You have to meet the competencies for each and gain experiences across the entire lifespan. So, newborn pediatrics, adult geriatrics, mental health. There's some small mental health component, antepartum care. Those are the typical experiences. We do allow for a specialty rotation in certain areas as well, like cardiology or gastroenterology, dermatology, things like that.
Thank you. All right, so here are some of our teammates. Down at the bottom left, this is one of our academic advisors. And next to her is our fabulous librarian, that's Zach. Next to him is one of our clinical advisors, works with George, that's Jamie Wheeler. Next to that, I believe, is another academic advisor. And then we've got IT, and then Dr. Pesta Walsh and I on that picture there. In addition to that, when you're in your didactic program, you'll be working with course coordinators and course faculty. So each course is designed with a faculty leader, and that's the course coordinator. And then they have course faculty working with them so that there's plenty of people to give you the attention that you would like to have while you're in their courses. We have regional clinical faculty. Dr. Pesta Walsh referred to that group of faculty. Those are your faculty who will work with you very closely while you're in your clinical practicum, ensuring that you are meeting the competencies and the visit requirements and just helping you along the way. We've talked about academic and clinical advisors. We have financial aid officers who you will be assigned to one on admission, and they will help you as far as financial aid is concerned. And then we also have credentialing coordinators, and those are folks that work with you leading up to clinical to make sure that contracts and the administrative aspects of being a clinical student and having a clinical site, making sure that all of that comes together. So again, there's a large group of people here to support you through your education. Dr. Pesta Walsh, did I miss anything? George, did I miss anything on that?
I don't think so.
Nope, I don't
There
think
is
so.
there is a question in the chat, and Martha, you can answer. Yes, thank you. You can answer that so that I didn't steer her wrong.
Yes, of course. So the best option would be winter 2026 because the degree must be conferred before the deadline. The deadline is June 25th for fall 2025. So the best option would be winter 2026.
Thank you.
You're welcome.
All right. So these are some pictures of our campus. We're very, very proud of our campus. It's absolutely beautiful. It's in Versailles, Kentucky. This top left picture is a picture of our dining hall. When you're on campus, we have 3 hot meals a day, plenty of options for you, snacks, treats, all the things. In the middle picture there, that is our president's house. It's a reception area where we do events, donor events, student receptions. Right next to that on the top right is the Welcome Center. So that would be one of the first places you would come to when you come on campus to get your ID badge and the things that you'll need while you're on campus with us. In the bottom left, that picture with the trees, back in the background there is the student housing. So we have 3 lodges for students when they come on campus. And then in the middle, you can tell we like food because we've got 2 pictures of our dining hall right there. That's another view of it. And then, of course, that bottom corner, that's the first thing you'll see. That's the sign as you turn in to join us on campus. Dr. Pesta Walsh, do you want to talk about life as an FNP and then I'll chime in?
So I graduated from Frontier in 2008. And, you know, the best thing about this job, one of the best things, and I actually had a discussion with a student about this today as we were talking at 9 o'clock this morning, and she was getting off the night shift, is I don't have to work any more nights. Okay, that's, you know, that's an aside. I love this job. I get I have a lot of variety in what I do as an FNP. I get to work in the clinic and take care of people and really get to know families in providing their health care. And there's a lot of variety, so much like nursing where you have a lot of variety in what you can do with your RN degree. It's the same with this degree. And so I do a little family practice. I do a little urgent care, and you know, that helps to, you know, feed my desire to not do the same thing every single day. You get the variety in what you're doing, and yeah, that's why I love this job, is the variety, and then taking care of families from, you know, baby to grandparents and really building that connection with them.
And then my clinical position is in what's called post-acute care. So I go into nursing facilities and provide primary care to the residents in long-term care facilities. I get to know them very well. I get to know their families, and I absolutely love it. But life as an FNP is so broad. You can do so many different things with that degree. You're not limited to any one population. You can see the variety of populations, ages. So the utility of the degree is whatever you want it to be. You can specialize into something very, very focused, or you can keep it broad. Um, I'd love to hear what any of you think about why you're thinking about FNP, if anybody wants to share. We're so fortunate as nurses to be able to join patients and their families at whatever point we join them, right? I mean, we already know that relationship as a nurse. And the FNP, I think, takes that just to another level where you are managing and directing the care of the people that you meet. And so it's a nice natural progression in your nursing career to be able to work with patients and families.
Audra, before we continue on, there is another question in the chat. I
Okay.
just didn't want it to be missed because we hadn't addressed it yet.
Okay.
Jamie is asking, she has a MSN in leadership. Will some of those hours obtained for that degree be considered for transfer towards MSN FNP?
I do not think so, Jamie. We could have an individual conversation about that because I don't know enough about the hours or your experience in that MSN leadership program. But the FNP program, like the program is preparing you for that certification exam and working as an FNP. So those clinical hours and the time you spend here is dictated by all of our governing bodies, state boards of nursing, those type of thing. And they require that the hours for this degree fall in line with this degree. So I don't think that would transfer. I'm sorry.
Didactic courses there would be an audit though, correct?
Yes. Now the didactic courses we could look at. It depends on what you had. One thing to keep in mind when you're thinking about transfer courses is that our courses are across the lifespan. So if you've had something like pathophysiology, it needs to be across the lifespan. Pharmacology, physical assessment, all of those. So we could look at transcripts, and we do that many, many times, and we would let you know what could transfer and what would not.
Thank you. And that's what I was thinking more so of the didactic courses.
Gotcha.
And advanced health assessment, advanced patho. So I was
Gotcha.
thinking more
Very
of those.
good.
Right,
Yeah,
right.
yeah. So we would look at that with you and help make
Okay.
a determination there. Thank you for that question.
Thank you.
How about clinical placement or admissions questions?
I just have a question about what areas you are required to do clinical rotations in.
Well, that's a great question.
Yeah, I can take that. So we do have visit type requirements, so certain visit types. So you need, a certain number of newborn visits, well child visits. So small up to age 18, and then adult and geriatric visits, antepartum visits, speculum exams, men's health visits, and a few mental health visits. And so because that's the broad scope of what we do, we can see all of those types. We require a few of those, each of those visit types. We do not require you to spend like 150 hours in pediatrics or 100 hours in obstetrics or anything like that. What I tell students is, you have to spend enough time to get the visit types that we need, but also to feel confident in what you're doing. So somebody with experience in, antepartum care may not need as much experience as somebody that doesn't have any background in that type of care. So somebody with experience might do 60 or 80 hours of clinical in that area because they feel really confident in it, and they might spend more time in primary care versus somebody with no experience might spend 150 hours in obstetrics. So we don't put a time limit on that, but we do have the visit types, and you have to meet the competencies for each clinical course. Did that answer your question?
Yes, it did. I did have an additional question. Do you have to be with a pediatric NP, or can you be with a pediatrician, for example?
We do allow, so most of your clinical rotations need to be with a nurse practitioner. However, we do have up to 40%, so 300 clinical hours can be with MD, DO, or PA. Our preceptors have to have at least 1 year of experience and, be certified. But you can have up to 300 hours with MD.
And Jen, most of our students get their clinical experiences. To get them, they will need a primary care practice, a women's health practice, and a pediatric practice. If you have those 3 sites, you're likely to cover all of those visits that you need. Some practices might see a lot of those, like sometimes you'll find a community health center or a public health center that has all of that under one roof. But that's, I don't want to say it's rare because it's not rare, but it's not as likely. So generally our students need at least 3 sites.
Okay, thank you.
You're welcome. I hope that helps. Anybody else?
I have a question in regards to application and admissions. Typically, how long does it take to get a response after your application is admitted if you're accepted into the program? So, say for instance, I'm looking for the fall, which I believe the start is in October. Typically, when do you all make announcements of admissions? Just for planning purposes and work and what have you.
Great question. Once the application has been sent to the admissions committee for review, you can expect a response up to 4 to 6 weeks. You will receive an update from us to let you know your file is complete, it's now under review, and from there on, you're just waiting for those 4 to 6 weeks.
Thank you.
You're welcome.
Good question. Got anything in the chat? Okay.
I would say the admissions team works really hard to turn that around for students because we know they're waiting for that response. So, yeah, I don't think there's any chat.
Okay. And then in this picture, we love this quote that success doesn't come to you, you go to it, by Marva Collins. In this picture here, you see one of our F&P graduates and our faculty, Dr. Tarika Fuller. They're putting a pin on him during our graduation ceremony. We love to celebrate your success. We pride ourselves on being supportive of students and really trying to facilitate your progress through the program because your success is our success. All right. Any other questions at all about anything on your mind? We've got some email addresses here for your reference if you want to. I'm sure these slides will be shared, but if you want to take a quick picture of this slide here, we've got the FNU admissions, clinical advising, and financial aid website or email addresses there for any questions that you have for them. Things in the chat here. Thank you. Thank you. And then here, you can tell we love to celebrate our graduates, don't we? Showing you all kinds of graduates. Resilience, that is what it takes to be a student these days, and actually to be a healthcare provider, right? We have to have resilience. So adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. I think we've all had to practice some resilience. And again, another graduate there with Dr. Pesta Walsh, myself, and Dr. John. such an exciting day when we have graduation. All right, ready, set, jump. We hope to hear from you. I hope you have found this helpful. We have plenty of time. If you've got any other questions, you want to continue the conversation, we're happy to stick around. We appreciate that you joined us this evening, and hope to hear from you. We hope to see you. We love our program. It speaks for itself with its pass rates and our student success. And we really do hope to see you soon on that beautiful campus that I showed you.